I'm Jane Van Bramer, Sweetser's president and CEO, and we are proud to join other colleagues and partner organizations today as part of the Behavioral Health Priorities Coalition. Our children in Maine are struggling. There is universal acknowledgement that we are in the midst of a youth mental health crisis. The concerning trends include over 1/3 of high school students report feeling sad or hopeless for weeks. The rates of anxiety and depression in Maine youth exceed national averages, and more Maine children experience 2 or more adverse childhood experiences. These aren't just numbers on a spreadsheet. These are real Maine children, real Maine families hurting. Without the right support, without easy access to treatment, children experiencing mental health challenges or at risk for them face an increased likelihood of requiring higher and more expensive levels of care. The costs of our legislation is a drop in the bucket compared to the costs and risks of hospitalization, incarceration, residential care, and other long-term strains on our system. We know that half of all mental illnesses begin by age 14, yet 49% of the children in Maine will not receive treatment, and even less will receive evidence-based treatment. That is treatment that works. An act to expand child assertive community treatment, sponsored by Representative Lori Gramlich, is designed to change that. Child Act is an evidence-based treatment designed to support children to remain in their homes, in their communities, with intensive support. The Department of Justice specifically noted Sweetser's Child Act team as a benefit to our state, when previously Child Act was cited as a gap in Maine's service system. Child Act brings comprehensive treatment and services directly to youth with significant mental health challenges and their families in their homes so they can remain in school and together. We use a strength-based model that instills in youth and their families hope, goals for the future, and a plan for getting there. Accessing behavioral health services in Maine is difficult. Workforce is the primary barrier to service expansion. We can't have services without staff. What made Sweetser's Child Act teams viable was the addition of the incentives that supported training, hiring, and retention of Child Act's staff. Our legislation seeks $320,000 to expand this wonderful service and create 2 new Child Act teams in Lewiston and Bangor, both high needs and underserved areas. In addition, early identification and preventative interventions are the hallmark of an effective behavioral health care system, and in reducing costs to taxpayers. One of the best forms of prevention we have is embedding clinicians in schools alongside school staff members to reach those children with highest needs. An act to provide grants to schools that contract for behavioral and mental health services, sponsored by Senator Rachel Talbot Ross, will provide those critical resources needed to stabilize therapy in schools and prevent further cuts from providers of these services. Schools play a critical role in providing a safe, non-stigmatizing, and supportive natural environment in which children and their families can have easy access to early intervention and treatment. The purpose of this legislation is to improve student access to mental health and support students and families. Our school therapists work year-round and have literally helped thousands of children navigate bullying, depression, anxiety, parental divorce, and other adverse childhood experiences. Sweetser operates this program at a loss and supplements it with other programs and donations because we believe in its prevention mission so much. But it is simply not financially sustainable for any provider. And due to the loss of over $1 million this past fiscal year, Sweetser has had to reduce our presence from being in over 100 schools to now being in about 45. This bill will stabilize the program for all providers and ensure it continues. Now is the time to strengthen Maine's behavioral health system for our next generation. Together, we must meet this moment with leadership and expand access to programs that work, backed with the resources to properly staff them. The time to invest in our children's future is now. Thank you.